So IVIG although IVIG mostly works, there are cases where Kawasaki disease is what's called refractory, or doesn't respond to the initial therapy. And that happens in about 10 to 20% of cases. And it mostly happens in patients who are at extremes of age, but it's also the very old or very young patients. And sometimes also patients who have already, severe disease at the onset. And when that happens, there are additional therapies that one can do, either repeat the IVIG, use a pulse steroid dose, or use biologic medication. And this is which one of these to choose is currently under investigation in various studies. There's also what's called incomplete Kawasaki disease, which is important to remember. So incomplete Kawasaki disease is when you have a patient that does not seem to manifest all of the symptoms of Kawasaki disease, and so it can be very tricky. Patients may have one or two of these 5 cardinal signs that we talked about. So, really ideally, we want to see all 4 or 5 of these cardinal signs, having conjunctivitis, red hands and feet, the mucous membrane changes, and rash. But in some cases, you might only get 1 or 2 of these, and that can be difficult for the diagnostic physician, because you don't know whether you're just dealing with fever or rash or not. And it tends to be that the rate of incomplete Kawasaki disease is higher in kids who are young, very young, under 6 months of age. And in some cases, there have been some studies that have suggested that patients who are little infants who are under 6 months of age might only have prolonged fever, and then are subsequently found to have coronary aneurysms, suggesting that they did have Kawasaki disease, even though they had none of the other features. And so prolonged fever is one of the reasons to get an echocardiogram in a young infant, 6 months of age.